Common signs of autism. Well, when we talk about autism, you have to understand first that it is a developmental problem in the brain that's causing some of these symptoms to manifest. Some of the common symptoms of autism that you have to look out for are delays in problems with communication, problems with socialization and social skills, and also issues with repetitive behavior. Some of the main communication problems that parents often worry about when they think that their child may have autism is just lack of language or delay in language. Other signs that one needs to be aware of is if a child does not respond when their name is being called. In regards to socialization skills, a child with autism may not want to play around with other children their age. They're kind of isolated, quote unquote, in their own world. They're not responsive to emotions, and they don't really get the cues on how to respond to certain kind of situations. In regards to the repetitive behavior, some of the things that you may see in a child with autism, they may be fixated on certain patterns, on certain things. So, for instance, they may say the same thing over and over again. It's what we call echolalia. Another thing that you may see in a child with autism in their repetitive behavior, sometimes they do not like to change the pattern of what they're accustomed or used to doing. So for example, if they're used to using a red cup to drink a beverage on a daily basis, if a parent changes the cup, they may throw a tantrum if it's a different color cup, excuse me. In regards to the toys that they play with, they may fixate on one part of the toy versus playing with the toy in full totality. So for example, I often tell parents just to note the way that the child interacts or plays with certain objects. For example, a toy truck. A child with autism may not want to play with the full truck. They may just be fixated with the wheels and just want to watch the wheels turn around and only play with the wheels while they're interacting with that object. So those are a few things that you need to be aware of: the communication delays, the socialization problems, and also the issues with the repetitive behavior. It is a bit more difficult to diagnose in girls. With boys, they have more of a prevalence of autism. We are not quite sure why, but we tend to see that worldwide. But generally, for both boys and girls, you are going to see some of the same issues with communication, with socialization skills, and also with some of that repetitive behavior and some of the irritability that may arise in certain situations. Certain stimuli can lead to a child being more irritable and having some of the attention problems that you were talking about. So when we're talking about the spectrum, that just means there are different variations or different severity, I should say, of the symptoms that you are going to see. Some people or some children with autism can have very mild symptoms, whereby some people may not even pick up the cues that they may have an autism disorder. Other people have more severe symptoms. So symptoms vary from person to person. So one child with autism is not the same as another child with autism. Everyone's symptoms kind of manifest differently.